Our brains are incredibly complex organs. They control everything we do, from our thoughts and emotions to our movements and senses. When something goes wrong with the brain, it can have a profound impact on our lives. Neurodevelopmental and neurocognitive disorders are two categories of brain disorders that can affect people of all ages. Understanding these disorders is essential for providing early intervention, effective treatment, and support for individuals and their families. Neurodevelopmental disorders typically emerge during childhood and affect the development of the brain. These disorders can impact a wide range of abilities, including learning, communication, social interaction, and behavior. Examples of neurodevelopmental disorders include autism spectrum disorder, attention deficit/hyperactivity disorder, intellectual disability, specific learning disorder, and communication disorders. On the other hand, neurocognitive disorders involve a decline in cognitive function from a previous level of functioning. They typically affect older adults but can occur at any age, and these disorders can cause problems with memory, thinking, language, judgment, and behavior. Common neurocognitive disorders include delirium, Alzheimer's disease, vascular neurocognitive disorder, Parkinson's disease, and Lewy body dementia. By understanding the causes, symptoms, and treatments for these disorders, we can help individuals reach their full potential and live fulfilling lives. Recognizing the early signs and seeking timely intervention can significantly impact an individual's trajectory and improve long-term outcomes. The brain is a complex organ with interconnected regions responsible for various functions. Understanding how these regions interact and are affected by neurodevelopmental and neurocognitive disorders is crucial for accurate diagnosis and effective treatment. Autism spectrum disorder is a neurodevelopmental disorder characterized by difficulties with social interaction, communication, and restricted repetitive patterns of behavior, interests, or activities. The term spectrum reflects the wide range of challenges and strengths individuals with ASD may exhibit. Individuals with ASD may have difficulty understanding social cues, engaging in reciprocal conversations, and developing meaningful relationships. They may also exhibit repetitive behaviors like hand flapping, rocking, or repeating certain phrases. These behaviors can sometimes be self-soothing mechanisms in response to sensory overload or anxiety. Communication difficulties can range from mild language delays to complete absence of spoken language. Children with ASD often find comfort in repetitive activities and may show intense focus on specific interests. Understanding their unique ways of interacting with the world is key to supporting their development. Managing ASD involves a multidisciplinary approach that addresses the individual's specific needs. Early intervention programs are crucial and typically involve speech therapy, occupational therapy, and social skills training. Behavioral therapies, such as applied behavior analysis, can help individuals develop positive behaviors and reduce challenging ones. Medications can be used to manage co-occurring conditions like anxiety or hyperactivity. Attention deficit/hyperactivity disorder is a neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity. While these symptoms are common in childhood, ADHD can persist into adolescence and adulthood, impacting various aspects of an individual's life. Inattention in ADHD can manifest as difficulty sustaining attention, forgetfulness, disorganization, and easily getting distracted. Hyperactivity often involves fidgeting, restlessness, excessive talking, and difficulty engaging in quiet activities. Impulsivity can lead to acting without thinking, interrupting others, and difficulty waiting their turn. For individuals with ADHD, the traditional classroom setting with its emphasis on quiet, focus, and stillness can be particularly challenging. Recognizing the signs and providing appropriate support is essential for their academic success. Managing ADHD typically involves a combination of behavioral therapy, educational support, and medication. Behavioral therapy can teach individuals coping mechanisms for managing their symptoms, while educational support can help them succeed in school. Stimulant medications such as methylphenidate or amphetamine, dextroamphetamine can improve attention and reduce hyperactivity and impulsivity. Intellectual disability is a neurodevelopmental disorder characterized by significant limitations in intellectual functioning and adaptive behavior, which covers everyday social and practical skills. This disability originates before the age of 18 and can range in severity from mild to profound. Individuals with intellectual disability may have difficulty with learning, problem-solving, communication, and self-care. The level of support needed varies depending on the severity of the disability. Some individuals may require minimal support to live independently, while others may need lifelong assistance with daily tasks. Individuals with intellectual disabilities can lead fulfilling lives with the right support system. Inclusive workplaces and community programs play a vital role in promoting their independence and social inclusion. Managing intellectual disability involves a holistic approach that addresses the individual's cognitive, adaptive, and social-emotional needs. Early intervention programs can provide educational support, therapy, and life skills training. As individuals transition into adulthood, vocational training and supported employment opportunities are crucial for promoting independence and inclusion. Section 5. Specific Learning Disorder: Unlocking the Potential to Learn. Specific learning disorder is a neurodevelopmental disorder that affects a person's ability to learn and use academic skills. This disorder is characterized by difficulties with reading, writing, or math, despite having average or above average intelligence. These difficulties are not due to a lack of effort, opportunity, or environmental factors. Individuals with dyslexia, a specific learning disorder in reading, may have difficulty decoding words, recognizing sight words, and comprehending written text. Dysgraphia, a specific learning disorder in writing, can affect handwriting, spelling, and written expression. Dyscalculia, a specific learning disorder in math, can manifest as difficulty with number sense, memorizing math facts, and solving math problems. Simple accommodations like colored overlays or audiobooks can make a world of difference for students with specific learning disorders. By tailoring learning strategies to their individual needs, we can empower them to reach their full potential. Managing specific learning disorders typically involves individualized educational interventions and accommodations. Early identification and intervention are crucial for minimizing academic difficulties. Educational psychologists can conduct assessments to identify specific learning needs and recommend appropriate interventions. Specialized tutoring, assistive technology, and classroom accommodations can help individuals with specific learning disorders succeed in school. Section 6. Communication disorders: breaking down barriers to expression. Communication disorders encompass a range of difficulties with speech, language, and social communication. These disorders can affect a person's ability to understand and express themselves effectively. Speech disorders involve difficulties with the production and fluency of speech sounds. Articulation disorders affect the clarity of speech sounds, while fluency disorders, such as stuttering, disrupt the rhythm and flow of speech. Language disorders involve difficulties with understanding and using spoken and written language. They can affect vocabulary, grammar, and the social use of language. Social communication disorders involve difficulties with using verbal and non-verbal communication in social settings. Individuals with these disorders may have difficulty initiating and maintaining conversations, understanding social cues, and adjusting their communication style to different contexts. Play-based therapy is a common and effective approach for addressing communication disorders in children. By incorporating therapy into fun and engaging activities, children can learn and develop their communication skills in a natural and enjoyable way. Managing communication disorders typically involves speech-language therapy, which focuses on improving communication skills such as articulation, fluency, vocabulary, grammar, and social communication. Early intervention is crucial for optimizing communication development and minimizing the impact of communication difficulties on social, emotional, and academic development. Section 7. Neurocognitive disorders: a decline in cognitive function. Neurocognitive disorders are a group of disorders characterized by a decline in cognitive function from a previous level of functioning. These disorders can affect memory, thinking, language, judgment, and behavior. Delirium is a neurocognitive disorder characterized by a disturbance in attention and awareness. It typically develops over a short period and fluctuates throughout the day. Delirium can be caused by a variety of factors, including medical conditions, medications, substance intoxication or withdrawal, and surgery. Major neurocognitive disorder, previously known as dementia, is a more severe form of cognitive impairment that interferes with independence in everyday activities. Alzheimer's disease is the most common type of major neurocognitive disorder. Engaging in mentally stimulating activities such as puzzles, reading, and social interaction can help maintain cognitive function and potentially slow down cognitive decline. Mild neurocognitive disorder is a less severe form of cognitive impairment that does not interfere with independence in everyday activities. However, individuals with mild neurocognitive disorder may experience noticeable changes in cognitive function and require greater effort to complete tasks that were once easy. Vascular neurocognitive disorder is caused by damage to the blood vessels in the brain, leading to cognitive impairment. Parkinson's disease is a neurodegenerative disorder that affects movement and can also cause cognitive impairment, particularly in the later stages. Lewy body dementia is characterized by abnormal protein deposits in the brain called Lewy bodies, leading to cognitive impairment, hallucinations, and movement problems. Section 8. Assessment tools in psychiatry. Decoding the mind. Psychiatric assessment tools are standardized instruments used to evaluate an individual's mental state and cognitive abilities. These tools play a crucial role in diagnosing mental disorders, monitoring treatment progress, and making informed clinical decisions. Kaplan and Sadok's Synopsis of Psychiatry, a widely respected textbook in the field of psychiatry, outlines various assessment tools and their clinical applications. The Mental Status Examination, or MSE, is a structured interview that assesses various aspects of an individual's mental state, including appearance, behavior, speech, mood, affect, thought process, thought content, perception, cognition, and insight. The Mini Mental State Examination, or MMSE, is a brief screening tool for cognitive impairment, assessing orientation, attention, memory, language, and visuospatial abilities. The patient interview remains a cornerstone of psychiatric assessment. Building rapport and trust is essential for gathering accurate information and understanding the patient's unique experiences. The Wechsler Adult Intelligence Scale, or WAIS, is an intelligence test that measures cognitive abilities, including verbal comprehension, perceptual reasoning, working memory, and processing speed. The Thematic Apperception Test, or TIAT, is a projective test that uses ambiguous pictures to assess an individual's unconscious thoughts, feelings, and motives. The Rorschach Inkblot Test is another projective test that uses inkblot images to assess personality characteristics and emotional functioning. Section 9. Early intervention and management empowering individuals with neurodevelopmental and neurocognitive disorders. Early intervention and proper management are crucial for improving outcomes for individuals with neurodevelopmental and neurocognitive disorders. By addressing these disorders early on, we can minimize their impact on development, education, and overall well-being. Early intervention programs for children with neurodevelopmental disorders typically involve a multidisciplinary team of professionals, including psychologists, educators, speech-language pathologists, and occupational therapists. These programs provide a range of services tailored to the child's individual needs, such as speech therapy, occupational therapy, behavioral therapy, and educational support. Caregivers of individuals with neurocognitive disorders often face significant challenges. Support groups and respite care services can provide invaluable assistance and emotional support, allowing caregivers to prioritize their own well-being. Managing neurocognitive disorders often involves a combination of medication, therapy, and lifestyle changes. Medications can help manage symptoms such as memory loss, cognitive decline, and behavioral changes. Therapy can provide individuals and their families with coping mechanisms, support, and education about the disorder. Lifestyle changes such as regular exercise, a healthy diet, and mentally stimulating activities can help maintain cognitive function and overall well-being.